There's often a lot of confusion on the topic of if somebody should see a chiropractor or a physical therapist. I'm often asked, I don't know if I should see you or if I should go to a physical therapist, or, of course, what's the difference between a chiropractor and a physical therapist? And my answer is always, this day and age, there shouldn't be too much of a difference. With the amount of research that is out there, it's pretty clear that what chiropractors traditionally used to do and what physical therapists traditionally would do, they are both effective if they're applied in the right situation. So historically, for example, chiropractors were more known for their hands-on therapies. They would do more of the spinal manipulations or adjustments of the spine. They would do more kind of massage, myofascial release techniques, and then a lot of stretching. Essentially, they wanted to limber people up and loosen people up, get rid of those restrictions. Whereas physical therapists, on the other hand, would focus on trying to strengthen, finding areas of instability, areas of weakness, and they wanted to exercise those areas. They wanted to get people's support system, the muscle support, the bones, let's get that strong and strengthened. And as I said, this day and age, there's enough research to show that spinal manipulations, myofascial releases, stretching, when applied the correct area and in the right situation, are very effective. That's what's needed. There are situations where if somebody's weak, if they're unstable, then what they need is the strengthening. So more and more these days, chiropractors, if they're keeping up with the research and if they are trying to keep themselves educated and provide the best possible treatments for their patients, they are doing more physical therapy type of work, rehabilitation, showing people how to do the correct exercises to keep themselves strong, stable, good alignment, and good posture. Physical therapists, because there's so much research coming out showing that spinal manipulations can be effective for certain conditions, certain scenarios, there are more and more physical therapists who are learning how to do the spinal manipulations, and they are using that as part of the therapy, or part of an approach to provide therapy to their patients. So that's kind of, in a nutshell, the difference historically between chiropractors and physical therapists, and then letting you know now there shouldn't be much of a difference. If you go to a good chiropractor or a good physical therapist who's competent, stays up to date with the research, who's knowledgeable on the different types of therapies and techniques, hopefully you wouldn't notice too much of a difference. So hopefully that helped you out, and of course, as always, if you have any questions, let us know.